Do you know the number one cause of hypothyroidism? That's a condition where your thyroid gland does not make enough hormone. Did you know that there's a major cause that most doctors never check because, quite frankly, it doesn't change their treatment of your problem? It's called Hashimoto's Thyroiditis. It's an autoimmune condition. It's actually the most common autoimmune condition in the United States, where your immune system actually attacks your thyroid, destroys it, making it smaller and decreasing its ability to produce thyroid hormone. So you're hypothyroid. Then you have all the symptoms of hypothyroidism, right? The fatigue and weight gain or resistance to weight loss, even with restricted calories and exercise and constipation and depression, a tremendous number of things that happen, changes in hair and skin, and just a number of problems begin to occur. And did you know that most people that have Hashimoto's, they don't feel better when they take medications, especially thyroid hormone replacement, because the cause of their problem is not just that they have a low thyroid hormone level. It's actually that their thyroid itself is being destroyed by an immune process that's creating inflammation and disrupting a ton of processes that are essential for your body to be able to use your thyroid hormone. So what I want to talk to you about today is that disease process, which is called Hashimoto's Thyroiditis. I want to talk to you about a few of the causes. I want to talk to you about a different way that we have to approach it if we're going to improve our health. So I'm Brad Shook. I work with people around the world and across the United States to help them investigate the driving factors behind the symptoms that they're having. If they're hypothyroid, they have brain fog, they have fatigue, they have these problems with body weight, whether they can't lose weight or they're gaining weight, or they're constipated, their skin, their hair, their nails, their depression, right? Most people that I work with, they know that they have a thyroid problem, but they still don't feel well despite the medications. And there's a lot of reasons for that. Primarily, the reason that we see people not get well is because their health is not being looked at completely enough. So when we talk about the thyroid is very interesting. Your brain actually signals another gland in the brain called the pituitary gland, to produce a hormone called TSH, which is what most doctors measure. And TSH is thyroid stimulating hormone. Now it stimulates the thyroid, which is here, it's a butterfly-shaped gland, to produce your thyroid hormones, primarily T4 hormone. 93% of your output is T4, 7% is T3. Now, your brain signals this process so that the gland will produce enough hormone. Most people, they have an autoimmune process causing their hypothyroidism called Hashimoto's. 9 out of 10 people, okay? The process results in low thyroid hormone output. Their doctors prescribe them a thyroid hormone replacement, and some of them feel better and some of them don't. And the reason for that is because the production of the hormone is just one piece of the puzzle, okay? We have to look at 4 things with any hormone. We have to look at production. Is there enough hormone? Then we have to look at transportation. Once the gland, wherever the gland is located in the body of whatever hormone we're talking about, the thyroid is here. Once it produces the hormone, can the thyroid hormone get where it needs to go throughout the bloodstream? Can it be transported properly? That can break down. That can break down a number of ways. The thyroid also has to be converted. Your T4 hormone has to go to the liver, the intestinal tract, the peripheral tissues throughout your body. It has to be converted into T3, which is the usable form of thyroid hormone. That conversion process can break down a lot of different ways. And then, so you have to look at the transportation and the conversion. Then you have to look at sensitivity. So if the hormone can get where it needs to go, if it can get to, let's say, the cells in your toe, or to your hair, or to your brain, right? If it can get there, then are the cells sensitive to the hormone? And this can break down a number of different ways. Deficiencies can create problems with sensitivity. Inflammation can create problems with sensitivity of the cells of your body to the thyroid hormone. And, ironically enough, Hashimoto's, which is an autoimmune process, produces a lot of inflammation. So it tends to break down this physiological process, which is complex, right? Several different points throughout the process of production and utilization by your body can be disrupted. As a matter of fact, there are over 24 different ways that this physiology can break down. And that thyroid hormone replacement only addresses one, the quantity. So we have to look at the bigger picture, or we're going to be missing the keys to really trying to improve your health. And that's what I help people do. I help them investigate these driving factors. And I think it's important that you're first aware of this problem so that you can then become your own advocate and really start to become an active participant in your healthcare, asking the questions that you need to ask to get the bottom of the symptoms and the problems that you're having. Or you're never truly going to be well. You're just going to be putting a Band-Aid and treating the symptoms. So we want to actually address the causing factors. So remember, you've got to consider more than just the amount of hormones. You've got to look at the production. Can you produce it? If not, well, then that's where that thyroid hormone replacement comes in. Can you transport it where it needs to go? Are your cells sensitive to it? And then can you break it down and clear it from the body? Those are some of the keys that you need to consider. I'm Dr. Brad Shook. You can find out more about us, our practice. You can watch hundreds of our videos. Just go to drbradshook.com, drbradshook.com. If you have any questions, please do feel free to contact our office.